Hello.
Sir, good morning, sir. Sir, mic mute la irukku.
Okay, இப்ப சார் வேற ஒரு லைன் இருந்து கனெக்ட் பண்ணியிருந்தாராமா, அது நீ மியூட் ஆஃப் பண்ணி ஆடியோ ஆஃப்ல இருந்துச்சு, அது சார் கூப்பிட்டுருந்தாங்க.
Okay, okay. Ma'am, sir, welcome address, sir.
கனெக்ட் பண்ணிட்டாரு சார், வந்துருவாரு.
Okay. Sir, good morning, sir. Start பண்ணிடலாமா sir? Okay, Jayaraja. Yeah, thank you so much. Check பண்ணிடுறேன்.
Madam, good morning, madam.
Sir, good morning, sir.
Audible, madam?
Start பண்ணிடலாமா sir?
It's audible, ma'am?
Yes, sir, it is audible.
Yes, sir.
Okay.
Okay.
A warm good morning to all the participants and the chief guest and Annadhuri sir and Manju ma'am. There is nothing more attractive than a great positive personality. Its beauty never fades away with the time, says Edmund. With these great words, I welcome the great personality Dr. Annadhuri sir to deliver the welcome address. Welcome, sir.
Very good morning to all. So it's immensely pleasure to take great privilege to deliver the welcome gathering. So on behalf of NSSL of Bharatiya University and Department of Women's Studies, Bharatiya University, we jointly organize this COVID-19 epidemic period. Everyone need attention about iodine deficiency. So wonderful topic chosen by Dr. Kamalini ma'am, who have chosen the topic of conduct this program. So we are really, first I be proud to join with this organization, the webinar. I welcome today a resource person, Mrs. Kavita, Senior Dietitian, PhD Hospital, Pilamedu, Coimbatore. She is going to deliver the lecture, Impact of Iodine Deficiency, Sign and Symptoms. So first session, and afternoon session, Dr. Muthu Kumaran, Assistant Professor, Thuthukudi Medical College, the role of iodine in development of children. So need a very important aspect, and they have maybe given valuable information to future generation. So and our honorable registrar, Dr. Professor K. Murugan sir, will going to deliver the validatory felicitation address. So on behalf of NSSL and the Department of Women's Studies, I welcome everyone on this. Thanks, sir. Thank you very much for giving the opportunity. Thank you.
Thank you, sir. Thank you so much. Beauty isn't about having a pretty face or isn't having a pretty mind or a pretty heart. It's about the most importantly having a pretty heart and a pretty beautiful soul. So here is such a wonderful personality, Dr. Mangai Karasi, to introduce the resource person. Welcome, ma'am.
So, ஒரு
Mangai, ma'am,
questions வந்து sir நடத்துறது
உங்களோட audio mute-ல இருக்கு.
Good morning, all.
Then
I'm very happy to introduce today's resource person, Mrs. Kavita, Chief Dietitian and Head, Department of Dietetics, PhD Institute of Medical Science and Research Practice, Coimbatore. She is the first practicing registered dietitian in Coimbatore in 2017 and head of the Department of Dietetics at PhD IMSR Hospital since 2001. She was served as a vice president from 2014 to 18 and co-convener from 2019 to 21 of the Indian Dietetics Association Coimbatore chapter. She is a life member in various associations. She has received first Best Practicing Dietitian Award from Indian Dietetics Association Coimbatore chapter for 2017. She has presented papers in various conferences and seminars at national and international level. I appreciate Mrs. Kavita for her commendable progress in doctorate research in foods and nutrition at Bharatiya University. The commitment and involvement to patient care is commendable. I appreciate you for the best service to dear people at the right time, including managing all food service operations of 1,400 bed hospital as per NABH standards, manpower management and recruitment of employees, training new dietitians, and involved in the equipment purchase in advanced level. Teaching, training, research guidance, subject expert in Board of Studies, member in Internal Quality Assurance Cell, organizing camps are her responsibilities in her service. Now I invite Mrs. Kavita to address the gathering. Welcome you, ma'am.
good morning, everybody. Thank you for this opportunity. Dr. Kamalini ma'am for this wonderful session and meeting. Are you able to hear me, ma'am?
Yes, ma'am. It's not very clear. A bit little more louder, ma'am.
Now
Yes, ma'am. That's fine.
you are able to hear now.
Yes, ma'am. Thank you. Please proceed.
So Can I present my slide? Good morning. And today's topic is impact of iodine deficiency. I think we had a wonderful session yesterday on iodine. The, I think there were two speakers yesterday, and we were discussing several aspects on iodine and what's the importance and how we can combat this deficiency. As you see, in India, iodine deficiency is prevalent, and maybe for the past 20 to 30 years, the government is taking steps to correct this problem. So the significance of iodine is enormous, and as an essential trace element, it lies in its role in thyroxine production, and it is a constituent of thyroxine, the active principle of the thyroid gland. And it is a very important mineral, and it plays a major role in activating, or it's a constituent of thyroxine. And this gland plays an important role in the energy metabolism and in the growth of the body. So you all know how important it is in the energy metabolism. Functions
Ma'am,
of iodine. Unless we know
so
the functions of
weaker.
iodine, we will not know what is the consequences if there is a deficiency.
Ma'am, you're
The
not
deficiency
audible.
now.
Yes, ma'am.
Yes, sorry. So iodine is essential for the production of thyroid hormone called the thyroxine, which is secreted by the thyroid gland. And this thyroxine controls the basic metabolic rate in the body as it controls the metabolism of all nutrients. And thyroxine also regulates the rate of oxidation within the cells. So it regulates the functioning of the nerve and muscle tissues also. And it, is, it stimulates the physical and mental growth. So when you go through the functions, you can understand how important iodine is for our physical and mental growth and for the metabolism. So in our daily diet, we are expected to provide adequate amounts of iodine. And iodine is an essential component of the thyroxine T4 and the triiodothyronine T3, and it must be provided from the diet we eat. So in case there is any inadequate intake of iodine, it leads to inadequate thyroid hormone production, and all the consequences of iodine deficiency will stem from the associated hypothyroidism. So we have to be very cautious. In developing countries, especially Asian countries and in African countries, iron deficiency has been identified as one of the modifiable factors that have an adverse effect on child development. It is a global public health problem, and in combating it, emphasis should be placed on diagnosis and correction level of community rather than the individual. So, I'm sorry, you're not able to hear. Can you hear me now?
Ma'am, I think you must be little more louder. It's
Now,
very
ma'am?
louder, ma'am. Yes, ma'am. It's not
Now,
clear.
now can you hear me?
Yes, ma'am.
Yes, thank you. So each one of us have to take the responsibility in finding out the people who are deficient in iodine. Maybe we have to go out to the community to find out, and maybe we have to arrange some camps to find out the iodine deficiency, especially in the uh, rural areas. There are certain few salient facts of iodine. Maybe we'll have to know that also. Iodine deficiency is one of the main causes of impaired cognitive development in children, and number of countries where iodine deficiency is a public health problem has halved over the past, which means there are certain programs to correct iodine deficiency, and a number of countries where iodine deficiency is a public health problem has halved over the past. It is according to the global report on iodine status. Around 54 countries are still iodine deficient, and one among the country is India. Efforts are required to strengthen sustainable salt iodization program, and iodine deficiency is the world's most prevalent yet easily preventable cause of brain damage. So, in case we take adequate measures to provide iodine through the diet to all to all age groups, maybe we can prevent this brain damage that is caused by iodine deficiency. Today, we are on the verge of eliminating it, an achievement that will be hailed as a major public health term that ranks with getting rid of smallpox and poliomyelitis. We all know polio is eradicated, and it is only because of efforts of the healthcare sector, government, and the public. And I think we should be able to eradicate the iodine deficiency also. Usual recommendations: how many micrograms of iodine do we require per day? And the requirements vary based on the age, and from birth till old age we require iodine in different quantities, and it has to be provided only through the diet we eat. So at from birth to 6 months we need around 110 micrograms, and for infants from 7 months to 12 months it is 130 micrograms. Children 1 to 8 years it is 90 micrograms. Children above 9 years to 13 years it is 120 micrograms. It increases during the teenage, and for the adults and teens above 14 we require around 150 micrograms. In case of pregnancy and lactation, the requirements increases for the pregnant woman to provide adequate for the growing fetus also. So we are expected to provide this nutrient recommendation, iodine recommendation through the food we eat. So whether it's a newborn baby, in case it is a newborn baby, then the pregnant woman is expected to take adequate amounts so that when she is nursing, she is able to provide provide around during the lactation period. So from birth to 6 months, that 120, 110 micrograms should go from the nursing through the breast milk. And infancy, maybe we start feeding the babies, supplemental feeding, we start by around 7th month. So we should provide from the diet we give to the babies. And each stage of life is important, and for the growth and development, we need to definitely provide iodine. If you see, if we do not provide adequate amounts of iodine, then it leads to deficiency disorders, iodine deficiency disorders, and it is again because of lack of iodine in the natural food. You see, many of the areas that is nearby the hilly regions, especially in our country in the Himalayan belt, the soil lacks in iodine. So whatever is grown will be the iodine content in the foods that is grown in that soil will contain less iodine. So that is one cause for lack of iodine in the natural food. The consequences: there is definitely birth defects, increased risk for abortions and stillbirths in pregnant women, retarded physical growth in children and infants, impaired mental functioning, hirsutism in children, hypothyroidism, and goiter in adults. So if you see the spectrum of the IDD, that is the iodine deficiency disorders across the lifespan, in fetus, before the baby is born, there's a, I mean, can lead to abortions or stillbirths, congenital anomalies, increased perinatal mortality, endemic fragilism, deaf mutism. And in case of neonate, after the baby is born, can lead to neonatal goiter, neonatal hypothyroidism, endemic mental retardation, increased susceptibility of the thyroid gland to nuclear radiation. Child and adolescent, that's an important phase where the growth spurt is very high, especially during the infancy and during the adolescent stage, there is increased growth spurt. And in case we don't provide adequate amounts of iodine at that time, it can lead to goiter, subclinical hypothyroidism, subclinical hyperthyroidism, impaired mental function, retarded physical development, increased susceptibility of the thyroid gland to nuclear radiation. And in case of adult, again, goiter with its complications, hypothyroidism, impaired mental function, spontaneous hyperthyroidism in the elderly, iodine-induced hyperthyroidism, increased susceptibility of the thyroid gland to nuclear radiation. And it is a major, iodine deficiency is the major cause of preventable mental retardation, which means if you provide adequate iodine through all stages of life, you can prevent brain damage and mental retardation. So it is in our hands. And iodine status in the body can be assessed maybe in different methods. One is by the thyroid gland size. Maybe we can find out from the population history of iodine nutrition and its special status. By examining the neck, you will be able to know whether the thyroid gland is enlarged or not. And urinary iodine concentration is an indicator of recent iodine intake. TSH, or the thyroid stimulating hormone. It's a useful biomarker in neonates, pregnant, and lactating women. Thyroglobulin, it's a useful marker in children and adolescents, and thyroid hormone concentration. So if we are able to find out the iodine status, we'll be able to know whether we are providing adequate iodine. So this picture shows you the global scorecard of iodine nutrition. It was taken in 2017. It is based on the median urinary iodine concentration in school-age children and adults. You see the violet colored areas are insufficient iodine intake, which is less than 100 micrograms per liter. Okay, so most of the African countries and here in the these are the hilly regions where the soil itself is deficient. Okay, so the adequate intake is found in almost all the well-developed countries. Okay, and excessive intake is also present in certain areas, especially in the South American, the Caribbean area, and here in South Africa, few areas of South Africa. And there are certain areas where we do not have any data to show. In our country, also, we are not survey was not done, and maybe we have very little data. Okay, so this shows that the intake itself is less, where we need to intervene. So what happens if we do not provide adequate quantity of iodine through the diet we eat? We see the consequences. It leads to diffuse and nodular goiter. And if you see, the goiter is the most obvious manifestation of iodine deficiency, and a swelling in your neck can, few people will be able to notice the difference in the mirror. And low iodine intake leads to reduced T4 and T3 production, which results in increased TSH secretion in an attempt to restore T4 and T3 production to normal. So this TSH also stimulates thyroid growth. Thus, goiter occurs as part of the compensatory response to iodine deficiency. So there is an enlargement of the thyroid glands. And this goiter is initially diffuse but eventually becomes nodular nodes. Okay, because the cells in some thyroid follicles proliferate more than others, and over time nodules can enlarge and undergo cystic degeneration, hemorrhage, and also calcification. Therefore, in regions of iodine deficiency, children and adolescents generally have diffuse goiters, while adults who live in these conditions of long-standing iodine deficiency have nodular goiter. So, iodine deficiency favoring thyroid follicular cell replication also increases the chance of mutations in the TSH receptor gene. If you see, this is the normal thyroid gland, okay, which is in the shape of a butterfly, that has enlarged because of lack of iodine. Okay, it is called as goiter. And you can find criticism in children. Okay, goiter is usually seen in adults, and criticism is usually seen in children. So, in addition to intellectual disability, criticism is accompanied by other neurological and somatic defects also,
Ma'am, sorry to
has
interrupt.
led to criticism being subdivided into two. We have the neurological and
Ma'am, sorry to interrupt.
myxomatous types.
Kavita,
So,
ma'am.
neurological criticism is characterized by intellectual disability. So, their IQ will be less, and deaf mutism, gait disturbances, which means they are not able to balance, walk straight,
Ma'am,
and
sorry to
stammer.
interrupt.
Because
Kavita,
of
ma'am.
hypothyroidism. They will not have hypothyroidism, but they will have these neurological disturbances. It is
Kavita,
thought
ma'am, can you
to
hear me?
result from hypothyroidism in the mother during early pregnancy, but a euthyroid state postnatally, that is after delivery, due to inadequate adequate iodine intake in the newborn. And this cretinism, myxomatous cretinism, is characterized by intellectual disability, short stature, and hypothyroidism. So these children definitely have a lower IQ, they have a short stature, they are short, and they also have hypothyroidism. And it is thought to result from the iodine deficiency and thyroid injury predominantly late in the pregnancy and continuing after birth. So this is usually seen in children. Can you see this is goiter, okay, enlargement of thyroid glands, and cretinism you can see. Maybe I'll show you one more picture. Uh, their IQ is less, and they also have stunted growth. And they also, few people also have myxedema. Can you see the skin? Okay. And
Ma'am.
sometimes there is neonatal and infant mortality also. When there is severe iodine deficiency, it increases the neonatal and infant mortality, which has an effect that can be reduced up to 50% with correction of severe iodine deficiency. You can correct all these problems if you provide adequate iodine. And hypothyroid or intellectually disabled infants may suffer more birth traumas, and they are more prone to infectious disease. And also nutritional deficiencies typically of the poor rural communities is seen, and iodine deficiency is prominent in them. Mild to moderate iodine deficiency during pregnancy is also present, and this potential adverse effects of mild to moderate deficiency during pregnancy are uncertain. And developmental studies in iodine deficient regions have many limitations, including an inability to distinguish between the persistent effects of fetal iodine deficiency and the ongoing effects of iodine deficiency in childhood and adolescence. There is also subclinical neurological effects that has a minor neuropsychological defects have been described in children born to mothers exposed to mild to moderate iodine deficiency during pregnancy. So during pregnancy, if the mother is deficient, then the fetus is also deficient, and when they are born, they might have several uh, defects, including neuropsychological defects. So if you see, this is cretinism. There is stunted growth. Okay, actually, this girl is more than 18 years old. Okay, you can see stunted growth and enlarged bellies. Okay. And what are the signs and symptoms of iodine deficiency? How can you identify, and what are the signs in general? How do you find out whether you are hypothyroid or do you have any deficiency? Some people have the swelling of the thyroid glands in the neck, which is called as goiter that I showed you. And usually low levels of thyroid hormones can lead to hypothyroidism, which has the typical symptoms like fatigue, you feel tired always, increased sensitivity to cold, people will have constipation, they have a dry skin, and weight gain will be enormous, puffy face, okay, muscle weakness, you feel very weak, elevated blood cholesterol levels, pain or stiffness in the muscles and joints, slowed heart rate. The heart rate is always low, and the hair becomes thin. There is depression, poor memory, and a heavier than normal period in case of menstruating women. So, if you see all these symptoms might be present, or at least most of the symptoms are usually present in case of hypothyroidism. And hypothyroidism is because of the decreased intake of iodine, which leads to low levels of thyroid hormones. If you see, you feel very tired, insomnia, you feel like sleeping all the time. And many people are depressed. Definitely, there is hair loss and it becomes thin. Some people will have respiratory and swallowing complaints because of the goiter, growing goiter, increased size of the thyroid glands, which presses and tightens the neck, and metabolic problems like I told you, there'll be increase in weight. They feel very hungry, so their intake is very high, and even the developmental disorders are present. And skin is usually dry and sensitive to cold. Very few people have moist skin. Otherwise, it is dry skin. Goiter, enlarged thyroid gland, and increased cholesterol levels and pregnancy complications. In case the woman is pregnant, it leads to miscarriages, developmental disorders, mental retardation in the fetus, growing fetus, lead to retinism. So, infants, hypothyroidism is likely to cause frequent choking. பொறப்போகிறது. So, when the baby is breastfed, the baby will have frequent choking. Okay, they will have large tongue, puffy face. The babies will have constipation. Okay, they will have difficulty in passing the motion and poor muscle tone and extreme sleepiness. They'll be sleeping always. Even adults, you feel very sleepy. And in case of children and teens, this condition may cause poor growth. So growth is, I told you earlier, it is required for the metabolism, and in case we don't provide adequate amount, can delay the growth and development. And in case of children and teenagers, the poor growth, delayed to the development, delayed puberty, so poor mental development, cognitive issues. So what happens? They will have very low IQ, trouble in learning. They find it difficult to memorize and store everything in their memory, and very difficult to express whatever they have learned. So what happens? Their studies are affected, and they will have mental disabilities, especially in children. So growth retardation. They don't grow as per the normal standards. Okay, their height is they are little short. Okay, and apart from that, even the skeletal development is poor. Means their bones are not strong. So in fetus, the iodine deficiency can lead to hypothyroidism, goiter, and so many other problems. So in fetus, it is seen as abortions, stillbirth, congenital anomalies, which means certain organs are not found properly, increased perinatal mortality, increased infant mortality. So some babies die before they are born. That's called a stillbirth. And some people, they at the time of delivery, they die. And neurological criticism, mental deficiency, deaf mutism, static diplegia, squint eyes, and all these things I think we have discussed earlier. Dwarfism. And in case of neonates, the newborn, neonatal hypothyroidism. And in case of children and adolescents, retarded mental and physical development. In adults, it is goiter and its complications. There are so many complications if we do not treat hyper and hypothyroidism. Hyperthyroidism is uh, increased functioning of the thyroid glands, whereas hypothyroidism is decreased functioning of the thyroid glands. And all ages, goiter,
Ma'am, your mic is muted, ma'am. Ma'am, your mic is muted.
Can you hear me now? Can you hear me now?
Ma'am, I think your mic has got some problem, so you need to place it here, ma'am. Ma'am, can you hear me? How does we get you? Ma'am, can you hear me? Kavita,
Can you
ma'am.
hear me now?
Kavita, ma'am.
Hello, ma'am. Mobile and disconnect ಆಯ್ತು join again. Okay, okay. నాకు but ಇದನ್ನ disconnect ಆಯ್ತು. Can you hear me now, ma'am? Kamlavini, ma'am, can you hear
Yes,
me?
ma'am. Yes, ma'am.
These symptoms would indicate life-threatening condition. is being a danger to everyone or others, including threatening, radiation, the level of such as confusion, delirium, lethargy, hallucinations or delusions, chest pain and chest tightness, chest pressure, palpitations, etc. Respiratory or breathing problems such as shortness of breath, difficulty in breathing, labored breathing, wheezing, not breathing, or choking. And why it is a health problem in India? The soil of the subcontinent has little iodine, so whatever we grow have very few traces of the element, and mostly the Indians are prone to iodine deficiency disorders. And the most popular method of tackling this problem is by encouraging the consumption of iodized salt, which reaches about 92% of the Indian households. And as per the several studies, around 350 million population remain at risk of iodine deficiency disorders that can lead to goiter, hypothyroidism, and even brain damage. And how is it progressing in India? The government of India established the National Goiter Control Program in 1962 at the end of the second five-year plan. And the objectives of this plan was to identify the goiter endemic regions of the country and supplement adequate iodine. And this also primarily focused on the so-called the goiter belt, that is the Himalayan and the Tarai region in the north and northeastern parts of India. And today, I think we have come a long way from a district-centric approach of this program in 1962 to having a national level program today covering over the whole country. Nearly 97%, 91% of the household in the country have access to iodized salt, with 71% consuming adequate iodized salt. And iodized salt production in India was less than 200,000 metric tons, and now it has been increased. So the key factors contributing to this remarkable progress of the IDT control program in India are effective translation from research to policy, political commitment, involvement of the private sector in production of the iodized salt, legislation to ensure iodization of the salt, and catalytic role played by the DOCA of the academic institutes, civil society, and international agencies. So iodine can be obtained by the consumption of foods that naturally occur. So we try to include the seafoods which contain iodine, especially the fish, seafood, kelp, some drinking water and vegetables that is grown in iodine sufficient soil. Or we'll have to add iodized table salt or foods enriched with iodine. So these are some of the foods that are rich in iodine that we'll have to include in our daily diet. So mostly it is the seafoods, non-vegetarian foods, and milk and cheese, eggs, and sea vegetables. Okay. And apart from that, there are certain foods that are enriched or fortified with iodine. Maybe we can use those food items. So the sources, iodine content of fruits, grains, vegetables varies with iodine content of the soil, and the iodine content of the meat varies with the iodine content of the soil and the plants that the animals eat. And iodine found in the seafood is dependent on the seawater fish and the freshwater fish. That's the difference. Edible fish contains around 30 to 300 micrograms per 100 grams, whereas the protein-rich food also supply iodine. Milk and yogurt contain 60 to 80 micrograms per 100 grams, and beans such as navy beans also contains iodine. The iodized salt will provide around 68 micrograms of iodide. And we can also enrich the cereals like bread and other grain products, like we have the cornflakes which is enriched with iodine. Apart from that, the seaweeds, dairy products, egg also provide adequate amounts of iodine, and certain other vegetables like cauliflower, cabbage also have to be avoided. And in general, we have to provide a adequate amount of iodine to the diet, and it has to be a balanced diet also. So to provide adequate iodine, we have to provide all these animal foods, or we'll have to stick on to the iodized salt consumption. Thank you. Kamalaveni ma'am, are you able to hear me? Kamalaveni ma'am,
Yes, ma'am.
are you able to hear me?
Ma'am, can you hear me? Kavita, ma'am.
Yes, ma'am. Can you hear me now?
Yeah, finished your presentation, ma'am.
Now?
Ma'am, it's not audible for me. One second. Ma'am, am I audible to you?
Kamalaveni ma'am, can you hear me?
Yes, ma'am. Kavita, ma'am, can you hear me?
Yes, ma'am.
See, others, can you hear me?
Yes, ma'am.
Yeah. Can you hear Kavita, ma'am, speaking?
Ma'am, the voice.
Okay. So, did she finish the presentation? Kavita, ma'am, I think your mic is in mute.
Hello.
Yes, ma'am. Now I can hear you.
I'm sorry for the interruption. Were you able to hear the last few slides?
Okay, okay, okay. Please go ahead, ma'am.
Were you able to view the last few slides and
Ma'am,
were
no,
they
you
able
have
to hear
not. You
me?
have stopped sharing the screen.
I'll do it now. You're able to hear me now?
Yes, ma'am. Yes, ma'am. Now you're presenting.
So we were discussing on the iodine deficiency, how it can progress and lead to hypertension, diabetes, vitamin D deficiency, obesity in case we are not treating it properly. So apart from that, there are life-threatening conditions also, like they can become a danger to themselves or others, including threatening irrational or suicidal behavior, bleeding when they are pregnant, change in the level of consciousness or alertness, such as passing out or unresponsiveness, change in the mental status or behavior change, and chest pain, chest tightness, chest pressure, palpitations, etc. Respiratory or breathing problems such as shortness of breath, difficulty in breathing, labored breathing, wheezing, or not breathing itself, or choking. So why do we have this problem in India? Since we are a subcontinent which has a low iodine content in the soil, so whatever we grow in that soil, maybe we'll have few traces of iodine. So most of the Indians are prone to iodine deficiency disorder. So to tackle this, we have to encourage the consumption of iodized salt, which reaches to about 92% of the Indian households. And several studies have shown that around 350 million population remains at risk of iodine deficiency disorder that can lead to goiter, hypothyroidism, and even brain damage. So how has it progressed in India? The government of India established the National Goiter Control Program in 1962 at the end of the second five-year plan. And the objective was to identify the goiter endemic regions of the country and supplement intake of iodine.
It primarily focused on the Goiter belt, that is the Himalayan regions and the Tarai regions in the north and northeastern parts of India. But now it is covering the whole country. And nearly around 91% of the households in the country have access to iodized salt, and the government insists on uh, providing iodized, insist on only selling iodized salt, and it also insists the people to buy and use only iodized salt to prevent iodine deficiency. Currently, the total iodized salt production is around 5.82 million metric tons, which maybe increases as per the requirement. So the key factors contributing to this remarkable process of iodine deficiency disorder control program in India are effective translation from research to policy. Several research has been conducted, and it also involves the political commitment, involvement of the private sector in production of the iodized salt, and legislation to ensure iodization of the salt, and catalytic role played by the academic institutes, civil society, and uh, international agencies to reduce iodine deficiency in India. So mainly we'll have to sensitize this policymakers, and we have to encourage the general public in consuming the iodine rich foods and also to use the iodized salt. And more focus should also be given to the rights approach. That is, every child has a right to access to optimal iodine nutrition to ensure optimal brain development. And health being a state subject, we have to, as per the Constitution of India, it is imperative that due focus be given on the state level IDD control activities also. And it is the individual, each individual should take adequate measures to create an awareness among the rural people and even the urban uneducated people to use iodized salt. Many of them, they don't use iodized salt, so we'll have to encourage them to buy and use iodized salt so that we can prevent iodine deficiency in this population. And iodine can also be consumed from the foods that are naturally present in the fish, seafoods, and certain vegetables. Apart from that, it is present in the iodized table salt. So most of the seafoods, the fish, shrimp, cod, scallops, milk and cheese, they are all sea vegetables. They are all rich in iodine, and even the eggs and yogurt can be used. Apart from that, even the nuts and oil seeds, lentils, beans, okay, are good sources of iodine, which can be included in the daily diet. So maybe we'll have to create an awareness to use the iodized salt and also include certain iodine-rich foods in the diet. So these are the other food items that are organically grown. And apart from that, we can also find iodine in certain fruits, grains, etc. And again, it depends. The iodine content depends on the soil that is grown. Okay, and edible fish usually contains 30 to 300 micrograms per 100 grams. And protein-rich foods also supply iodine. Milk and yogurt all contain around 60 to 80 micrograms per 100 grams, which means if you are able to drink at least 100 to 200 ml of at least 200 ml of milk and curd. Plus, if you're a fish eater, you can include at least 100 grams of fish. And including iodized salt in the daily diet will be able to provide adequate amounts of iodine. And sea beads, dairy products, egg also provide iodine. And certain food items are enriched with iodine, like your certain breads are enriched with iodine, and even like cornflakes and all, it's enriched with iodine and iron. So that can be included. So in general, we should include a balanced diet. We have to include a diet which contains all the cereals, legumes, and pulses, green leafy vegetables, fruits, and different varieties of fruits that are locally available, and also the non-vegetarian foods. In case we are vegetarian, then include lots of pulses and legumes, and also the milk and milk products, and fats and oils as per the requirement. So if we are able to consume a balanced diet, we should be able to provide the required amount of nutrients in a day's requirements, and we'll be able to prevent different micronutrient deficiencies. and macronutrient deficiencies. So, in a nutshell, try to include lots of iodine-rich foods in the daily diet, eat a balanced diet, and drink at least 1.5 2 liters of water per day, and definitely use only iodized salt in the daily cooking, and also educate the public and the community to use iodized salt. And maybe we'll have to create awareness, go into the community and help them to understand the importance of iodized salt and iodine in their daily lives. In case you have any queries, you can mail to me. Thank you. Thank you for the opportunity. Ma'am, over to you. Kamaleveni ma'am, over to you. Kamaleveni ma'am.
Yes, ma'am, I'm here.
Thank you for that session, ma'am. And in case any queries, we can discuss it. Or if it's time, I think they can mail to me and I can answer to them.
So the session is open to the questions. Like if anybody has any question, you can ask ma'am. I think maybe we can take 2 minutes and let know the questions to ma'am. Dear students, do you have any questions or shall we conclude the session? So, ma'am, I think I mean, the interaction on online is something like sometimes we get disconnected, and the continuity of some messages, it gets somewhere disconnected, and we have little hurdles in learning. I think we are finding it in that way. So, of course, students are interested in learning about iodine deficiency, and definitely your presentation has given them a big knowledge on iodine deficiency and how the iodine is a requirement for day-to-day life. And it was a beautiful presentation, ma'am. And definitely, I think the PPT that you presented would transfer the knowledge to all the students. I mean, to take home message is given on the PPT. I did read the PPT and it is very nice. And thank you for the beautiful presentation that you made, ma'am. In spite of your hectic schedule, you made your time to come over here and make a presentation to our students. Of course, our students are enlightened by the presentation that you have made, ma'am. Thank you so much, ma'am.
And I'm very sorry
On
for the
behalf of
interruption.
NSS and Department of Women Studies, Bharatiya University, ma'am.
Thank you. Thank you for this wonderful opportunity. And I'm very sorry for the interruption that had occurred.
No problem, ma'am. No problem. We're all in the learning process of, we are learning the virtual platform. It's fine, ma'am. Thank you so much.
Thank you, ma'am. Thank you.
Thank you,
you
ma'am. Thank
for
you.
all the
Okay.
audience. Thank
Yes.
you.
Dear students, I do have an announcement here. I think with this, the morning session will be over. As our next resource person is a doctor, he's on surgery in the morning. So we do have a session by 2 o'clock. So the session is from 2 to 3. So join us at 2 o'clock. I mean, by 1:45, the portal will be open, and all of you can join us at 1:45. So now you can take a break and come back at 1:45. Thank you. Thank you for the cooperation.
Thank you, ma'am.
So hope I am clear. All have to be back by 1:45. Thank you.